In the ever-evolving healthcare landscape, prioritizing initiatives to improve margins is crucial to maintain financial stability.
Network integrity is the ability to keep patients within the organization-defined provider network. Join us as we explain how network integrity can optimize your hospital's financial and operational performance.
Hi, I'm Shawn Williams, an Audit Director in our healthcare practice at Blue & Company.
And I'm Crystal Bingham, a manager in Blue's Hospital and Physician Operation Team. In our last video, we covered basics of patient loyalty and network integrity. And in this video, we are going to look at how a 500-bed acute care hospital on the East Coast incorporated network integrity to reinforce their patient loyalty.
The health system located in Mid-Atlantic region desired to build a strategic plan that allowed them to incorporate current service line market share and leakage to understand current specialties not being offered. The hospital started with primary care. They built a community constructed of all the employed providers in facilities by a national provider identifier. The community provided a baseline for the analysis to understand patterns, trends in migration patterns, and leakage. After the community had been developed, all employed and contracted primary care providers were analyzed using a trailing 12-month look-back to gauge where a patient traveled to subsequent providers within a 30, 60, or 90-day period after visiting one of the hospital system's primary care providers. This first data dive established the hospital's overall primary care loyalty to their system against the other providers in the geographic area. This high-level market share provided an initial picture of the hospital's ability to drive specialty and ancillary services. The other view, using the same data, provided the hospital with which individual primary care providers were referring to specialty providers within the hospital system, in-network providers, and which were referring outside of it, multi-network providers. Their in-network providers followed the patient from the provider to the specialist, and those providers shared 75% or more of their patients with the hospital system. Multi-network were those providers that had more outmigration, and their patients were split between the hospital system and other provider networks in the area. This graphic is an example of the market share data and also provides leakage opportunities for any outmigration concerns. It also provides data comparing a specified physician against other physicians in the area.
The hospital system focused on the multi-network providers from the market share analysis, as those providers are more likely to convert patients back to the hospital system versus the providers that did not have any shared visits with the system. Once the multi-network providers were identified, the hospital focused on understanding what referral patterns existed. Following the identification patterns prior to the meeting with the providers, the following questions were then considered. Is the provider new and had a recent trusted relationship or employment elsewhere? Is the specialty or ancillary service offered within the hospital system? What internal and external marketing has been done with the specialty or service line? And what outreach has been done with the identified multi-network providers to recondition outmigration patterns to the specialties that the hospital system had employed providers in?
The hospital also wanted to understand where patients were choosing to have their care in the primary and secondary service areas. One area of focus was ambulatory surgery centers. The hospital started with claims data pulled for patients living in zip codes in their primary and secondary service areas, the procedures that patients had, the provider rendering the service, and the billing provider that included total charges. The data was then analyzed on various data points, segmented by insurance, provider employment status, and health system or individual surgery center billing for that procedure. The data provided the hospital system with the ability to identify the ambulatory surgery centers where contracted medical staff were sending patients. The analysis also provided what procedures were being done outside of the system that management might want to consider adding, and leakage of procedures that could be done at the hospital. This graphic shows a share of care, which provides management the ability to see which providers are providing a specific procedure and whether they are employed or contracted. In the next part of our video series, we will break down how the data tells the story of network integrity.